Welcome to the Rolco Center for Mother-Baby Care. This video has been produced to help you understand what will be happening from the time you arrive in hospital for your cesarean section or C-section until the time you are discharged. As you watch the video, feel free to write down any questions you may have, and the nurse will answer them at the end of the presentation. You will arrive on the mother-baby unit 2 to 2.5 hours before the time of your scheduled C-section. You do not need to register at admitting. Please go directly to the mother-baby unit. Remember to bring your prenatal sheets as well as any medications you are on. It is wise to leave your personal belongings either at home or in the trunk of your car until after your C-section is over and you are in your own room. The nurse on the mother-baby unit will show you to a room and ask you to change into a gown. Please remember to remove your undergarments. She will complete your admission by taking your blood pressure, temperature, and baby's heart rate, as well as ask you a few questions. The nurse will prepare your incision site and insert an intravenous. You will be given a white pill at this time to help prevent any heartburn while you're lying down for your surgery. Approximately 30 minutes before your C-section, you will also be given a small drink to decrease the acidity in your stomach. Your C-section should proceed on time unless there's an emergency C-section happening. You will then be taken to the labor and birth unit by your nurse. She will discuss your medical history with your labor and birth nurse. Following that, you'll be taken to the operating room, or OR. A service aide will assist your partner with a gown, mask, hat, and booties to be worn in the OR. Your partner will wait outside the OR and will be brought in prior to the C-section starting. In the OR, the nurse will help you climb onto the delivery table. A blood pressure cuff will be put on, as well as a pulse oximeter to monitor your oxygen level and pulse. The anesthetist, your physician, and the nurses will discuss your care, which is called a briefing. To prepare you for the spinal anesthetic, the nurse will help you sit with your back curved and will support you in this position. The spinal anesthetic is administered by the anesthetist. The spinal needle is very thin, so you will feel a small poke as it is inserted into the appropriate space in your spine. The anesthetic, along with a pain medication, will be injected into the space. The needle is then removed. You may feel some tingling or warmth in your legs as the anesthetic begins to work. The nurse will now help you to lie down. Once you are lying down, the nurse and anesthetist will prepare you for your C-section. You will have heart monitor patches on your chest and a small pillow under your right hip so that you are not lying flat on your back. The nurse will listen to the baby's heart rate. Then the nurse will put a catheter into your bladder. You may feel touch, but you shouldn't feel any pain with the catheter. She will then wash your abdomen with an antiseptic solution. Following this, the physician will begin putting drapes on you. When everything is set up and everyone is ready, your partner will be brought into the room and will sit on a stool right next to your head behind the drapes. The people in the OR will include the anesthetist and your partner at your head, the obstetrician and their assistant, and the OR nurse over your abdomen, medical staff by the baby warmer, and your labor and birth nurse circulating around the room. Occasionally, there will be more people in the room, including students and trainees from different professions. A timeout will be called. Your nurse will go over a final checklist prior to starting the C-section. The C-section will begin once the obstetrician is confident that you will not feel any discomfort. They will assess this by pinching your abdomen and asking you what you can feel. Be honest and let them know if you feel anything like pressure or pain. Now the C-section will begin. If at any time you feel pain, nausea, or lightheadedness, please let the anesthetist know right away so he or she can fix this for you. It is normal to feel some pressure as your obstetrician works on your abdomen. It usually doesn't take too long for the baby to be delivered. When the baby is born, he or she will be taken over to the baby warmer, dried off, and assessed by the neonatal team. Baby will be given identification bracelets around his or her ankles. You and your partner will be given matching ones once you are in recovery. Once your baby is assessed, the neonatal nurse will bring him or her to you and your partner to see and hold. After your surgery is finished, your physician will discuss how it went, which is called a debriefing. Your partner and baby will be taken to the labor and birth recovery room to await your transfer from the OR. The nurses will clean you up and take you to the recovery room along with the anesthetist. You will be in the recovery room for a minimum of 60 minutes. The nurse will check your blood pressure every 15 minutes and assess the wearing off of your spinal anesthetic. She will do this by checking at what point on your legs you begin to have feeling again. In recovery, your baby can be placed skin to skin on your chest so that you can provide warmth and comfort. If you are unable to do skin to skin care with your baby, the nurse will be happy to help your partner provide skin to skin care. The labor and birth nurse will also help you breastfeed your baby while you recover. If your baby needs more observation after the delivery and is unable to stay with you, he or she will be taken to the nursery or the neonatal intensive care unit. Your partner is welcome to go along with them or stay with you. When the feeling has returned to your legs and you can wiggle your toes and bend your knees, you'll be transferred to your room on the mother-baby unit. Your intravenous and catheter will stay in for 24 hours. You should experience relatively little pain for the first 24 hours due to the pain medication you received through your spinal. However, you may feel some itchiness or nausea. Both of these symptoms are treatable, so please let your nurse know if you are feeling either. The nurses will help you get up out of bed within the first 4 hours. Please do not get out of bed by yourself for the first time. You are encouraged to keep your baby with you in your room during your stay on the mother-baby unit. Your nurse will help you with anything you might need, but it is also helpful to have your partner or a friend stay with you to help with your new baby. The maternity visiting program nurse will come and see you during your stay. They will explain the follow-up you can expect once you are discharged home. The usual length of stay in hospital is 2 to 3 days. If all is well, your doctor may discharge you earlier. Your baby will be discharged by the doctor responsible for his or her care, either a pediatrician or your family doctor. Please make sure you have an approved car seat to take your baby safely home. We hope that your stay at the Ralco Center for Mother-Baby Care is a pleasant one. The nurse will now answer any of your questions.